A hearty good afternoon and welcome to a session on the egg retrieval procedure. We are glad to have Dr. Major Maheshwari M today to help us understand this topic. Now, inside the world of fertility, the egg retrieval procedure is somewhat less known about, but it is one of the most important procedures out there. So the doctor will help us not just understand this, but also help us prepare if this is something that we should consider in the future. So, doctor, you have the stage.
Thank you very much. Hi, everybody. This is Dr. Major Maheshwari. I'm a senior consultant fertility and assisted conception at Apollo Fertility, Nagar branch, Chennai. The topic that we're going to discuss today is oocyte pickup. In other words, egg retrieval. This is a very important part of the IVF process. So many people they feel scared to undergo this process because they don't know what is an egg retrieval process. The IVF, in vitro fertilization, the IVF cycle cannot be done without this single process, which is the egg retrieval. Now, what exactly is IVF? I would like to give you a brief background about what an IVF is. IVF means it is in vitro fertilization, wherein the woman's eggs are taken outside her body, and in the lab, in the embryology lab, the egg and the sperm of her partner is made to meet. In conventional IVF, it is just the sperms are left with each egg to facilitate a spontaneous fertilization, versus in ICSI, intracytoplasmic sperm injection, each individual egg is held and a single sperm is injected into that egg. So this is the brief outline of what an IVF is. But to get that egg outside of the woman's body, it is this procedure which requires to be done. As I said, the egg retrieval. So egg retrieval is a minor process. I repeat, it is a minor process which is done under anesthesia in an IVF operation theater. Okay, so this is number one. And it would be an anesthesia is given for this procedure. So this procedure is painless. Now, when ovaries are stimulated, on an average, the mean stimulation duration is around 10 days, wherein a woman receives injections, oral medications to stimulate her ovaries to produce multiple follicles. Versus in a natural cycle, the hormones of her body facilitate a development of a single follicle. Now, here, since this procedure, we want eggs, more eggs. So that is why the stimulation vis-a-vis what is seen in the spontaneous cycle, the stimulation needs to be given with the help of external hormones. So these external hormones, which are actually safe to be given, these external hormones stimulate the ovaries to produce multiple follicles in both the ovaries, one on each side. So on an average, as I said, after 10 days of stimulation, a trigger injection is given to make the eggs inside the follicle. There is only one egg per follicle. So this trigger injection makes the egg that is inside the follicle from a mature state, from an immature state to a mature state. Now, trigger traditionally in a timed intercourse cycle or an IUI cycle, trigger is given to induce ovulation. In IVF, we do not want the ovary to ovulate, because if the ovulation happens, that means the eggs are no longer retrievable, the eggs are lost. So the idea of triggering is to ensure that the egg matures from an immature state to a mature state. But ovulation does not and should not happen. So after the trigger is given, around 36 hours later, anesthesia is given inside operation theater and eggs are picked up through the vaginal route. Now, if you were to ask me how eggs can be taken out through the vaginal route, just like a vaginal scan, the transvaginal egg pickup also requires a vaginal scan on which the needle is fixed, and under the guidance of the scan, the needle goes till the ovary through the vagina, and this needle is attached to a suction pump, and this fluid which is there inside the follicle is sucked out under a gentle suction, and this fluid, the follicular fluid, gets accumulated in a warmed test tube. These test tubes are placed in a test tube warmer block. Why is this so important? Because the humidity conditions in the operation theater, the temperature conditions in the operation theater, all these are very important factors to ensure that the egg remains healthy. So this suction device helps the doctor get all the eggs out of the ovary into the test tube, and this test tube is duly handed over to the embryologist, who examines this fluid under a microscope to confirm whether the eggs have come out. Sometimes, in spite of the best efforts, the follicle might not give me an egg. So, such a scenario can be sometimes seen if the trigger that is given might not have worked, or in a very rare case, it is called an empty follicle syndrome. So, the egg collection is one of the most crucial processes of IVF. As I said, this is a process which is done under anesthesia, so painless. It is a daycare procedure, which means the patient gets admitted just 2 hours prior to the procedure in a nil by mouth condition. Nil by mouth means nothing is to be ingested, whether solids or liquids, for at least 6 to 8 hours prior to the procedure, because this procedure is done under anesthesia. So after the procedure, 3 to 4 hours later, the lady, when she is well enough, when she has recovered enough, when she has eaten, she is allowed to go home. So, as I said, to summarize, this procedure is done under anesthesia. It is a daycare procedure. It is a minor surgical procedure. It is painless and it is crucial for IVF because this is the route through which the eggs are retrieved outside the body. Now, what happens after the egg retrieval? As I said, the fluid, the follicular fluid, is handed over to the embryologist for further processing. Now, the embryologist looks at the fluid, he or she identifies the eggs, and these eggs are separated. After a due course of time, these eggs are scraped because when these eggs come out, these eggs are covered by a cover of cells which might not tell us about its maturity status. So, 2 to 3 hours later, these covering cells are scraped off, at which time we come to know whether these eggs are mature or not. The mature eggs are subjected to ICSI, and 18 hours after the ICSI, that is the next day, we come to know whether the fertilization has happened. So, in women who have PCOD or who are young, sometimes as a result of hormonal stimulation, the woman can have a hyperstimulated ovary. Hyperstimulated ovary means the ovary is very big, there are plenty of follicles. Sometimes the hormone levels, the estrogen hormone levels, they are more than 3,500 picogram per ml. This is a scenario wherein the egg collection process needs to be done very carefully, because when the ovary is big, any needle that goes into the ovary, if that needle tears the covering of the ovary, it can lead to hemorrhages. These hemorrhages are inside the abdomen hemorrhages. So, talking about the complication rate is around 1%. The major complications that are routinely encountered can be vaginal bleeding, which is actually self limiting. A little bit of pressure takes care of it. And internal bleeding, which, as I just said, could be because of the tearing of the ovarian covering or damage to the intra-abdominal viscera. It can be urinary bladder, it can be the bowel, it can be, even in a very rare case, even the urethra. Ureter is the tube that brings the urine from the kidney into the urinary bladder. So, in cases wherein the ovaries are stuck to the uterus, or when we have to go through the cervix, ureteric damage can be sometimes encountered. So, these are the common side effects. Though I'm saying these are common, but the incidence of side effects is just 1%. And that too, in which cases these can happen, sometimes the doctor is able to put the patient at risk that this is the patient who can have these complications prior. So I was talking about the ovarian hyperstimulation. Even after the egg retrieval, because the ovary was hyperstimulated, the ovary remains big. So the woman is given an advice that she should not do strenuous activity, sexual intercourse is to be abstained from, and not only that, very, very rarely the ovary can undergo torsion on its pedicle post the egg retrieval process. The woman can have internal hemorrhage delayed if she had been on some blood thinner. If she's on blood thinner, these blood thinner tablets are usually stopped 5 days prior to the planned egg retrieval, and antibiotics are given after the procedure, painkillers are given after the procedure. And meanwhile, the embryology team keeps the patient and the doctor in the loop regarding the course of fertilization and embryo formation. So, if the patient is planned for a fresh transfer, 3 to 5 days after the after the egg pickup, embryo is transferred. If this cycle is destined to be a freeze-all cycle, then after the egg retrieval process, she is given medicines to bring down her elevated hormone levels and to plan her periods. Normally, in the present situation, a freeze-all cycle is favored by most of the IVF doctors, particularly in patients who are known to have PCOS. So, to summarize, egg collection is a minor process, painless, and done under anesthesia. It is usually a safe procedure. The complication rate is just 1%. Thank you very much.